In fact, if you are watching this podcast, you will never get multiple sclerosis because you'll know that you don't have to have multiple sclerosis and you can put it into total remission. All you
Awesome.
have to do is, I would say, as close to a no sugar diet as you can.
Hello, everyone. I had the pleasure of interviewing Dr. Annelise Barron. She's a professor and researcher at Stanford, and we talked about multiple sclerosis and what might be some of the causes of multiple sclerosis and how carnivore diet can be the cure. So please enjoy this video.
Let's go back to multiple sclerosis, what it is, and what these lesions mean,
Yes.
and then talk about the connection to, how changing your diet can completely change at least the
Yeah,
way you feel and your symptoms, okay?
I'd love to hear about that.
So in multiple sclerosis, right, the major focus in the way people talk about it is as an autoimmune disease, right? And that is because they see certain white blood cells essentially kind of attacking nerves and removing some of the myelin sheath from the nerve. And that exposed area where the white blood cell kind of chewed off some of the, think of it as the cladding on an electrical wire, right?
Right.
Where it chewed
Right.
off a little spot of the cladding. There will also be an amyloid plaque right outside the lesion. And in fact, it's very interesting that the plaque is composed of the A-beta protein or peptide, which is the same peptide that forms amyloid in Alzheimer's.
I
So
was
it's,
just going to ask you that because that
yeah,
sounded very familiar when you hear about Alzheimer's. You hear about the amyloid plaques.
yeah, and it's interesting. They kind of talk about with these amyloid diseases. Actually, that was discovered at Stanford, the presence of the plaque outside the lesions, and this is below the neck, right? Because you got to keep in mind that your brain is fully connected and integrated into an entire neural network, right? Okay, so Larry Steinman, who's my colleague at Stanford Medicine, he's actually the one who showed that, the presence of those plaques. Now, my research at Stanford for the past approximately 15 years, I've been working on understanding the connection between the innate immune system, the human immune system, but particularly the innate immune system, and Alzheimer's disease, and more recently, Parkinson's and glioblastoma, and connecting those with dysregulation of immunity and also with chronic infection. Now, going back to multiple sclerosis, that presence of those plaques, and then the fact that there are lesions in the brain, there are also plaques in the brain in multiple sclerosis, really connects it to Alzheimer's. And that, but, I also find it so exciting that MS is really kind of the first great discovery of things carnivore can cure. I'm going to say cure because,
Okay,
I
I'll
mean,
take it.
yeah, so I know that even a cautious mainstream physician would say remission, but let's think of the dis-ease. That's when you have, nerve pain, dysfunction of your extremities. I know some people in MS will, one hand will be weaker or their gait will be affected, their eyesight might be affected. I've even heard of people having trouble communicating. So, okay, now in my Alzheimer's research, we've been connecting both Alzheimer's and Parkinson's to chronic viral infection. And it happens that in those dementia related diseases, the viruses of interest are two different herpes viruses, one of which you will have heard of, the other one maybe not. So herpes simplex virus is the one that can cause cold sores, right?
Right.
And then there's another one called human cytomegalovirus. And these are both extremely prevalent and common in the human population. So HSV1, I'd say, by the age of 50, probably 60 to 65% of people carry
Wow.
HSV1. And, related and having similar effects is HSV2, but that's more like 35 to 40%, depending on which demographic we're talking about. Cytomegalovirus, by the time you're over 50, it's probably at least 85%. And then another important herpes simplex, it's like of the family herpes virus is Epstein-Barr virus. Now,
Hmm.
the interesting thing about like the viruses we think are the most responsible in Alzheimer's and Parkinson's are the ones you don't perceive. So human cytomegalovirus, almost everyone carries it, but nobody knows they have it unless they get an organ transplant, in which case they are intentionally immunosuppressed and their CMV can cause severe flu-like symptoms and it can be serious.
Hmm.
Same for cancer patients, right, where they intentionally immunosuppress. They deal with the cytomegalovirus and they're aware of it because their immune system is intentionally compromised as part of their treatment. But Now we talk about Epstein-Barr virus. Similarly, it's one you would rarely perceive that you are carrying. And if you do perceive it, it would be like fatigue, usually fatigue, maybe irritability, mood changes too. Now, all of those viruses share the characteristic that they reside within neurons. They live in the neurons, and
I
once
never knew that until you said
yeah,
it. I never
isn't
knew
that
that.
amazing?
Yeah,
So they completely live in neurons. Most of the time, they are in a kind of hibernation state,
right.
which is called the latent phase. And then if you get tired, like you're not sleeping enough, you have poor nutrition, you have high stress, and we're going to talk about that with respect to your life. You have
Right.
high stress, that's when they will say, "Hey, this is an opportunity for me to replicate myself and to be spread to another person," right?
Yeah.
So a lot of times people get Epstein-Barr virus for the first time when they go into a crowded kind of setting like college dorms
Hmm.
or new recruits to the army. And in fact, that's how they discovered that multiple sclerosis appears to be caused by Epstein-Barr virus reactivation. Because once you catch any of those viruses I've just listed and they're living in your neurons, they have extremely sophisticated biological program by which they turn off and down your immune response in order for their own survival. So they cannot be eliminated. As far as I know, no one's ever succeeded in completely eliminating one of these infections once you have it. It's your friend for
Wow.
life. You got to just accept it. But, just like any family we're stuck with, you figure out how to live with it and still be healthy. That's all you can do, right?
Just live with it.
So, I mean, and it turns out, and this is really the most glorious part of this message. Why does carnivore, I think, reliably put MS into remission? I would say for almost everyone if they would stick with it and be pretty strict. And, adding walking and good sleep is also important, right?
Yes.
You've got to move your body. I think walking is fine for, most people don't really struggle with severe MS until they at least hit their 30s, but usually it's even a little bit later. But, that's about the time when people start working really hard and they often don't have time to get their steps in. Right. And for
It's
me,
true.
like, I really think 7,500 to 10,000 steps a day, most days, is what we need to just stay in good shape. And that also affects our immune system. So what happened was the way they discovered and kind of validated the connection between Epstein-Barr virus and multiple sclerosis was through a study of the large military database, medical database, where
Yes.
they were able to correlate the fact that soldiers would get essentially mononucleosis, which is the first reaction to an Epstein-Barr virus infection. You get some severe fatigue the first time your body's fighting it, and then you'll produce antibodies and you'll start to try to keep it down. Some of these the proteins that are part of the Epstein-Barr virus can create, well, what happens is that you get a modification to the proteins that then your body creates antibodies to that they think, cross react to your B cells, which are the immune cells that produce antibodies. So this Epstein-Barr virus actually infects your B cells as well as your neurons, as well as your epithelia, which is your skin cells that are either, and remember, you also have, the lining of your mouth and sinuses and gut. That's also epithelial. That's also the outside world because things come into your body when you breathe air, when you
Right.
consume things. Okay, so they found that these people that got mono were much more likely to later report onset of multiple sclerosis. So they had like hundreds of thousands of soldiers. And like looking at this large military database, they were able to really kind of put together like, yeah, Epstein-Barr virus looked causative. And in fact, there had already been a lot of research, more speculative and harder because they didn't have the numbers. But so that now it's really believed to be a fact. And at my colleague at Stanford, who's the chair of the Department of Microbiology and Immunology, William Robinson or Bill Robinson. That's what he works on. I'm going to be meeting with him next week about this because I want to prove that essentially medically prove that the carnivore diet can put multiple sclerosis into remission. And
That's
why
so
does it do it?
exciting.
Yeah, right. I
That's
mean,
so
what
exciting.
what Anthony Chaffee's doing is really a great start. But the way to, you have to prove it by doing research where you apply a ketogenic diet to probably start with like the animal model of MS, which is it's a well-known animal model, and then you will connect it to humans. We'll be doing that ASAP. So why? Okay. When you eat sugar, your immune system weakens, but in particular, your innate immune system. And what happens is you have these extremely abundant white blood cells. Neutrophils are the ones I'm sure about, but it's probably also true for these other white blood cells called macrophages and T cells and B cells. So when you consume a simple sugar, and when I say that, I mean glucose, sucrose, fructose, right? Lactose. You consume simple sugars. It's been shown, this was published actually in 1973 with a human study, that for the next 5 hours, your white blood cells stop functioning properly.
Unbelievable.
Yeah, so this is, and I can send you a link to this paper so you
Yeah,
can maybe post it under
sure.
the thing so people can look
Yep.
at it.
I'll put it
But
in
it
the
was a
show
very
notes.
simple study where the scientist, he asked the human volunteers to just drink 100 grams of a sugar solution, the different sugars I listed, and then he drew their blood 30 minutes and then 1, 2, 4, and 5 hours after they drank the sugar. He took out their white blood cells and he gave them a performance test. So he put them in a, petri dish with bacteria, which they should go chase and eat and kill. That's what neutrophils do.
Mm-hmm.
That's called phagocytosis. And they were
Mm-hmm.
just not able to do it, right after someone had sugar. So now we think about how, at our age, how we grew up, we ate sugar like morning, noon, and night, and we didn't
And
think
in
about
between
it.
the morning, noon, and night, all day long.
It's so funny. I look back to growing up and just having no awareness that any food could hurt me in any way.
No,
Just Halloween
no.
candy, Christmas candy, just
And
ooh.
there are so many people in this world that are not paying attention to that as well, still today, even though we have all this information. So, sugar causes your body, your immune system,
To
to
stop.
not get rid of the viruses and whatever it needs to do to clean it. Like it stops. Is that what you're trying to
Exactly.
say?
Yeah, so on one hand, the reason carnivore is even more powerful than the ketogenic diet using vegetables, right? So there's people that do keto with meat and like low glycemic veggies, right? Like
Yes,
broccoli, asparagus, etc.
right. Side
And
salads.
and that's so much better than eating white flour and sugar and grain. It's so good to do keto compared to standard American diet. Great things already will happen there. But if people really want to optimize their health, they will go all the way carnivore, I think. And you can be carnivore-ish, like you can have occasional celebrations if you're able to do that and get right back on the wagon. But because it maximizes your immune system and rebalances it. And you saw in my interview with Anthony Chafee, I was really interested because my research is very much in the area of microbiology, and I'm interested in these different pathogens, bacterial, fungal, and viral, that can all lead to immune dysregulation,
Yeah,
Alzheimer's, Parkinson's, and MS. And, I've talked about the herpes viruses. Now, our body has a very effective way to keep chronic viral infections, which these are, tamped down and under control so we don't suffer from outbreaks, fatigue, and other symptoms. And that's called our interferon response.
okay.
So, interferon lambda, interferon gamma, these are two wings of the interferon response. There are many interferons. Okay, that response is obviously not working well if you're having Epstein-Barr viral reactivations that are causing these neurological effects.
Right.
And people can end up even in wheelchairs and having trouble walking. And you would think, certainly, the medical practice will tell you right now that you're not going to get better. You won't get out of that wheelchair. You're not going to be running and skipping along with great balance. Just accept that. But we have these, and you went through this nicely in your interview with
Yes.
Dave, how they have first, second, and third line drugs, and they're kind of a group of drugs in each one of these first, second, third. But once you've failed first, second, and third line, they say, well, good luck.
It is
which,
what it is. You
which is
get what you get.
yeah, and I consider this a very exciting time because citizen scientists who are simply talking to each other and sharing their experiences will solve this before the doctors do, and then we're going to go tell the doctors. That's what I'm going to be trying to do.
Well,
Like, hey
Annalise,
guys,
I'm just so grateful. I mean, I'm a citizen scientist at
yeah,
the very, bottom rung here, but you are a woman who has so much knowledge, so much information, so much ability to look at this stuff. And you went carnivore. Which happened first, the carnivore diet, or were you studying metabolism? Were you studying Alzheimer's? How did
Actually,
that work?
going carnivore is what led me to this discovery and watching. So, Dave Mack has like 1,500
Yes,
testimonials on his channel now. I'm sure I've watched like 1,100 of those. I've literally, and I've heard other people say that too. They're just so interesting. But for me, I'm treating each one as a medical case study.
amazing.
Because why would anyone do anything other than just tell the truth? We're just trying to help each other here, right?
And being on the other side of it, and I know you are as well, you've had some things that kind of healed for you, but being on the other side of it, why would I ever say that I had multiple sclerosis and now I don't if I've never had it? Like there's no
never would.
reason. There's no reason for that, you know?
But so really the answer is simple, and I've sort of just distilled this down in the last few days. What causes us problems? And MS is going to be the vehicle that allows us to fully realize this initially, but it's going to also be Alzheimer's, it's going to be Parkinson's, it's going to be so-called mental illness. It's all viral reactivation.
Wow. So, okay. So let's go back and let's talk about, so it sounds like this is like a perfect storm. There's a virus. Is there a
Oh,
genetic component too? This is
there
like this
is there
perfect,
is, there are genetic components, but those do not have to, dictate the outcome or the fate
because
at
genes
all.
turn on and turn off because of the environment that you put your body
Right.
in, whether
You
it
can,
be what you eat, the environment that you are living in. You talked about the skin and the epithelial cells. All that is like the outside environment. Even though we're
right.
eating it, it's the outside environment.
And now, to get to sort of a deeper level of complexity, and this will be something really interesting for you to check later. So, also, as people get older, they have a higher probability of getting gum disease,
Yes.
periodontal disease, it's called formally. And it starts with gingivitis. And when you have gingivitis, your gums start to kind of detach from your teeth. And as soon as you have gingivitis, you'll notice that if you floss, your gums will bleed, right? And
Yes.
then as it advances and the detachment from the tooth gets more extensive, say, so that you'll have 4 millimeters of detachment, that's considered pretty severe periodontitis. Okay, but why does that happen? You hear everybody in this carnivore space and all these thought leaders, inflammation, 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 right? That's what they focus on. Well, where does that inflammation come from? Why would your gums detach from your teeth? Well, you have little friends helping with that too, which are bacteria. So
Oh
there are
boy.
anaerobic bacteria in the mouth, and there are 11 that are well connected with disease, and they release enzymes that literally degrade your collagen to detach your teeth from your gum because they are anaerobic. Oxygen kills them. So they're trying to dig deeper and deeper to get away from oxygen, right? Isn't that
Oh, I
interesting?
heard you say that, but I didn't understand how they were anaerobic and how you were breathing. But they're trying to get away from the
Yeah,
oxygen.
oxygen kills them, so they dig deeper and deeper under your gum line. Now, here was the key. Those anaerobic bacteria, actually, I can share my screen and show you something really cool
Okay.
that will be very illustrative. Let me just get to the right part of this PowerPoint. This is just a presentation I gave a few days ago. We were talking about Candida albicans. Oh, it's here. So those bacteria, okay, now we have a picture. So you see this picture?
Yeah.
Okay, so the worst of those anaerobic bacteria is called Porphyromonas gingivalis. Now, here's the thing that bacterium, which is the little round ball, okay,
Yeah.
they don't eat sugar, they eat meat, they eat you, they eat your gums, okay, and they can only eat proteins and amino acids, and they get that from your gum tissue but they hate oxygen, so they like to form integrated dual biofilms with a fungus called Candida albicans, which you've also heard of, Candida. It causes, yeast infections, all the,
Thrush.
yeah, thrush.
Yeah.
And, if you ever sometimes really immunosuppressed, sometimes you'll see a white film growing inside your mouth.
Right.
That's Candida, right? So
Yep.
Candida overgrowth will almost always happen with people that have high blood sugar because Candida loves
Loves
sugar.
sugar.
And Candida is an absolutely voracious consumer of oxygen. So the reason they integrate like this, you see how they're just totally integrated in this biofilm, is
Yeah.
because Candida's consuming the oxygen, which protects the P. gingivalis. So look at this: aerobic escape, virulence, and adherence. This is a paper from 2023. And then here's another different paper where they show that Candida allows PG to, persist in an oxygenated environment because the Candida takes up the oxygen. That's so brilliant, right? And
So does
then
that,
now,
which comes first, the candida
yeah. So
or the
here's what I think.
gingivalis?
So the P. gingivalis is something that once you are inoculated with it by kissing somebody, or, like babies could get it from their mothers, because you remember when your baby drops his pacifier and dirt gets on it, you eat the dirt and give the baby the pacifier, right? But you pass, these organisms like Porphyromonas gingivalis then. Okay, so I think it's just chance if you catch Porphyromonas gingivalis. Candida is ubiquitous. You're born with that. Now, why are these important for the herpes viruses? This is what's so beautiful. I mean, as a mechanism, because of its complexity as a scientist, but also
Right.
because we figure out. So, P. gingivalis, let me move this out of the way. I'll make us small for a second. P. gingivalis releases an enzyme called gingipain. It promotes viral infection by disabling the interferon pathway, which is your only protection against Epstein-Barr. So look at this. Using a model of the human gingiva, it was demonstrated that P. gingivalis significantly increases infection with herpes simplex virus 1, promoting tissue distribution and propagation of the virus, and it promotes reactivation in neuronal cells by other mechanisms, interferon dependent mechanisms. So this is, I'm talking about Alzheimer's. This is also, I believe, true for multiple sclerosis.
Okay.
So P. gingivalis can only really thrive in that dual biofilm, right? Because it needs Candida to take up the oxygen. Now, metabolic health, diet, and exercise control the presence or absence of Candida. Because if you don't consume carbohydrates, now there's nothing to feed the Candida, right?
So it dies.
It can't live. So it
Right.
just, I mean, I'm sure it doesn't completely go away forever. As soon as you eat sugar again, it'll come back,
Right.
but it'll be gone as long as you keep your sugar low. And exercise burns the sugar that's in your bloodstream every day.
Oh.
So that's going to keep it lower even. So that's where the walking comes in, and just walking's fine. Now, these two together, they suppress, and that's what this paper showed. They suppress interferon lambda, which is a particular interferon pathway, which is key for your antiviral immunity. So if you're in a stage where you're eating sugar, you're feeding Candida, which is supporting PG, which is then turning off your antiviral response, and then all of your herpes viruses. Now, in the case of Alzheimer's, that's cytomegalovirus and HSV1. In the case of MS, it's Epstein-Barr virus. So it's bacterial, fungal, and viral, but you can interrupt that whole process just by eating meat.
Okay, so I'm gonna go back here. I'm gonna talk about what puts you at risk initially. So if somebody has the candida and they have the gingivalis, that combination in their mouth, do they also get it in their esophagus?
Yeah,
Their
it disseminates
it just goes
everywhere,
everywhere.
all through the gut, especially, and this is probably the cause of the gut diseases as well.
Could that be the cause of leaky gut?
Oh, yeah, absolutely.
So leaky gut seems like everyone has it,
Well,
right?
and it seems like every one of these complex, so-called idiopathic, meaning they don't know the cause, gut disorders, even Crohn's, which I'd say is the most severe of the inflammatory gut disorders. I just watched an interview with Dr. Sean Baker this morning saying he can put Crohn's into total remission with carnivore, and he's seen it happen many times.
Right. So
So,
leaky
and
gut can be contribute to Crohn's. It also can contribute. So the toxins from your gut go into your blood, right? And then they go into your liver. Could
yeah.
they help with fatty liver and diseases like
Oh,
that?
yeah.
Or-
I mean, fatty liver in large part is simply caused by the overconsumption of carbohydrates, especially fructose, because
right.
fructose, I don't know if you knew that fructose can only be metabolized by the liver, and it
Okay.
causes the quick laying down of fat in the liver and then throughout the body. So that's why I don't eat fruit hardly at all.
Yeah.
So, but think about, your gums and the state of your teeth are such an important way to know what your microbial state of health is, because I'm sure you noticed that after you went carnivore, as long as you stuck with it pretty well, your gums become pale pink, tight to the tooth, and you get no bleeding when you floss, right?
So I'm lucky. I have like really thick gums, right?
Yeah.
But when I was surprised and I went to the dentist. I believe it was right around the time I started the carnivore diet. So it was like, it had to be, maybe it was the appointment before that. I hadn't started it yet. And they stopped putting that measurement thing and they stopped measuring your gums. And they said, well, you have a little bit of the gums receding. You're going to have to come in and get them scraped. And I'm like, oh, that doesn't sound fun. So I never made the appointment.
Yeah, which is
So when
great.
I went back, probably in 6 months, and she measured my gums, I'm like, here we go. Never said a word. I'm
Because they
like,
were perfect. Because they're
she
perfect.
never said it reversed, never said I needed it. It was just like a non-issue.
Right. And I asked Dave Mack on No Carb Life to start asking guests. This was quite a while ago, like more than a year. I asked him to start asking his guests about their periodontal health for me, and he did that. And so basically everybody sees their gums just become perfect and they stop bleeding when they floss. And I can tell you now, think about what the P. gingivalis and Candida are doing to your teeth, making them inflamed and swollen and bleeding when you perturb them. Well, now just imagine that state of affairs going all the way down your gut.
Oh, yes. Yes.
So is it a surprise that your gut might bleed or no, it's the
No.
same situation because this is all connected. You're swallowing like a liter of saliva a day and it's full of those virulence factors that these bacteria, and by the way, Candida also releases potent virulence factors. Candida lysine is one. There's many. These other ones are called SAPs, but they cause a lot of degradation of tissue too. So really, it's a constant trench warfare against your healthy epithelial tissues and these pathogens. And you need your immune system 100% on point. And if you want to feel good, have good energy, even have a good mood, and so you can be a nice person around all the people that you love, you need to keep your immune system on point. And the best way to do that is the carnivore diet.
Unreal. Unreal. So I was
Anything?
thinking about the leaky gut. And what I wanted to say was, I had read something that said the leaky gut can lead to leaky brain.
Yeah.
And that's when the blood-brain barrier gets interrupted. And that can be related to multiple sclerosis,
Oh,
Alzheimer's
absolutely.
disease, Parkinson's disease, all the brain neuron
Yes.
diseases that
And
the
the
brain has. Because we have a barrier in our brain. Things don't get through. Things
Okay,
usually
but
don't
wait
get through.
until you hear this, okay? So
Okay,
the
I'm waiting.
interesting thing is that these herpes viruses, they're called neurotropic, okay? Meaning they live in the neuron and they use the neurons as a highway. They
So
are
they get through the
already in.
blood-brain
Yeah,
barrier.
the neurons pass through the blood-brain barrier, but there's no barrier inside of the neuron. So then these herpes viruses travel freely, through the nerve and reach the brain. But now these bacteria that can't, Porphyromonas gingivalis and Candida albicans, as they infect your gum tissues. Let's just focus on the gums for now. They produce virulence factors like the enzymes that chew, those are called collagenases that chew your gum tissue away from your tooth. And then P. gingivalis they release from the infected cells what are called outer membrane vesicles. So these are little spherical lipid bubbles, kind of like the mRNA shots were little spherical lipid bubbles, but these are
Okay.
natural. They come
Yeah.
from your infected cells. And inside of the little lipid bubble is all those destructive enzymes that turn off your immune system. Now, those can merge with your neurons and pass up into your brain through your neurons. So the actual bacteria and fungi, I mean, there definitely is some colonization of brain tissue that's been shown, which is bacterial, viral, and fungal. But even just these outer membrane vesicles that are released from infected cells, they merge with the neuron membrane and pass through the neuron, and they end up in the brain and they turn off the immune system of the brain. And we find these enzymes, which are called gingipanes, that's the one that turns off interferon. We find those in 89% of glioblastoma tumors. They're in Alzheimer's brains. This is published 2019. They're in Parkinson's brain tissue. I mean, we need to look. Oh my gosh, I didn't even think of it. We need to look at multiple sclerosis brain samples.
Yes.
I will do that
Yes.
next. I totally had not thought of that. Oh my goodness.
Yes.
We can do
Yes,
that right away
absolutely.
because
Yeah.
you use antibodies. You get the tissue slices and then you do immunohistochemistry and you can see if the specifically whether, these enzymes are present in the tissue. That's very important. Oh, I'm glad we had this conversation because
So,
you
I'm-
gave me
so
a
I'm
good
thinking
idea.
about the subscriber that I have, and a
Yeah.
lot of them have multiple sclerosis, or they have a family member, loved one, friend with multiple sclerosis. And I'm thinking about them right now as they're listening to you. And all these explosions are going on in their mind, like holy moly, like they're relating to you. They're relating to, yes, I had gingivitis. Yes, this has been going on. And
And
yes, I had Epstein-Barr virus.
yeah, you
Now
need to
what do
tell
I
your story
yeah,
about
that's
how,
where I was in reading some of the things that you sent me. I couldn't believe it. I had Epstein-Barr virus when I was 21.
yeah,
And I read about this before, but then you kind of go, okay, whatever. Like nobody's listening. I might have mentioned it to my doctor, and she's like, yeah, yeah, yeah. Like no one gets excited about it, right?
yeah,
Because when I read it originally, I was like, what? This is crazy.
yeah.
And then everyone's like,
Well, and
okay.
there's not really a great. Have you ever tried taking Valtrex, which is it's a generic drug for valacyclovir, which is it's a very specific inhibitor of the protease of herpes simplex virus 1, but it definitely has some cross-reactivity and benefit also for Epstein-Barr and
For Epstein-Barr
cytomegalovirus.
virus.
Yeah, and you can take that drug on maintenance a gram a day, and it doesn't impact anything
Okay.
else because it only binds to that one enzyme.
So
And
there's
I
one
do
thing I
that.
want to I want to mention that I don't know if people know that once you have Epstein-Barr virus, once you have mononucleosis, which when I told my husband this, I was talking to him and he said, "You didn't have Epstein-Barr virus, you had mono." I'm like, "What?" Right? So all these names are being thrown out to the general population.
Yeah.
And they're not realizing, folks, if you were ever diagnosed with mono, the kissing disease, right? That's what they used to call it. You're kind of embarrassed when you got it. If you were ever diagnosed with that, you have the Epstein-Barr virus. And I say have because it does not go away,
Yeah, you
right?
have it for life. And then I have more news.
Oh,
The
geez.
prevalence, and of course, the prevalence of Epstein-Barr virus infection, latent, is like 90 to 95%. As you get older, it gets higher. So
Everyone gets it. So you
everyone
had a
has it.
flu, it wasn't diagnosed as mono, you were fatigued, and then, you had some bed rest, and then you felt better and went back to work. Could have been the Epstein-Barr virus. You don't
Oh,
know.
yeah. I mean, and just basically, I would say everybody, given that it's 90 to 95%, and by age 55, I'm sure it's 95 plus.
Okay, so if you've
And
had the Epstein-Barr
cytomegalovirus,
virus,
just assume you have it.
assume you have it. But
We all have it.
that does not mean that it's an inevitable that you will get multiple sclerosis,
Yes.
right?
In fact, if you are watching this podcast, you will never get multiple sclerosis because you'll know that you don't have to have multiple sclerosis and you can put it into total remission. All you have
Awesome.
to do is do a low, I would say as close to a no sugar diet as you can, as close
But
to
but
carnivore as you
Annalise,
can.
they tell you calories in, calories out, right?
I
That's
know.
how you stay healthy. Eat a balanced, rounded diet, lots of colors, right? All the colors, and
Exactly.
just don't eat enough calories to make yourself fat. Calories in and exercise calories out. Do you believe in calories in, calories out?
I mean, I think there's some impact of how many calories you eat, but I think what's most important is your insulin level, which is,
Health,
yeah.
the health.
So if you don't eat carbs, your insulin stays low and you burn the fat,
Yep.
and, I think I have watched a lot of carnivore testimonials, particularly of women that are sort of menopausal or postmenopausal, where sometimes even on carnivore, they won't get to this slim teenage body they would like to regain, which we'd all love to regain even at age 55 or 56 or something, unless they consume maybe slightly less fatty cuts of meat or do OMAD. So what I've seen is like if you do one meal a day, ribeye, kind of, and a few eggs, that seems to work for everybody to optimize their body composition. But if you're eating 3 times a day and super fatty, you might not get thin as fast. But
Yeah.
It's
Yeah, I
really
think
like you're
at
saying, it's about health more.
exactly, because when you have multiple sclerosis, when you've been diagnosed with it, or diagnosed with Parkinson's disease or Alzheimer's disease, when you've got this diagnosis that's going to affect you for the rest of your life, you don't care about being ultra thin. You just care about getting your life back, right? That's the
Yeah.
most important thing
You
is getting your
realize
life back.
what's important is like waking up feeling good and being in a good mood.
Yes.
Oh, and I want to point something out. You're
Okay.
aware of, the connection now to mental health that they're seeing with the ketogenic diet, right?
Yes.
Where Dr. Chris Palmer in psychiatry at Harvard and Dr. Georgia Ede in psychiatry at Harvard
Yes.
each have great. So they both have, wonderful books out. One is called Brain Energy, and the other one's called Change Your Diet, Change Your Mind.
Yes.
And when you listen to Chris Palmer or Georgia Ede talk about why it worked, they will talk about how, keeping your insulin low with a ketogenic diet causes you to have better mitochondrial health. And you talked a lot about
I
mitochondria
did.
and the fact that the mitochondria are the powerhouse of the cell. If they are dysfunctional, then you don't have enough brain energy and you don't feel good. You will not have a good mood. And then there's also disorders of a process called autophagy that a lot of people are aware of now, which is your natural cellular housekeeping, turnover, and repair of organelles within your cells.
And
Now,
mitophagy.
and mitophagy, which
Yep.
is the continual renewal and refreshing of the mitochondria.
Mhm.
Because as you were saying, mitochondria are more like bacteria. They're, like little enslaved energy producing organisms
They work
inside of
for
our own
us.
cells. They work for us. We've enslaved them. And they've accepted it because we feed them and they feed us. So now here's the thing.
What?
So these viral reactivations by EBV, by HSV1, by HCMV, and there are many other viruses, by the way, that are going to turn out to be important. Rubella is one. One of my researcher collaborators is finding rubella in the brains of, people that died with Alzheimer's and Parkinson. And I want to come back to the topic of vaccines after this, okay?
Okay.
Because we give old folks so many vaccines, right? And super high dose. So mitochondrial dysfunction and disorders of autophagy are absolutely caused by viral infections and reactivation. So you were totally right with what you were saying about
Hmm.
mitochondria, as is Chris Palmer and Georgia Ede. The piece they're missing, they talk about diet causing inflammation, leading to mitochondrial dysfunction. It's kind of, they're missing a piece of it, which is the microbiology piece. So diet causes a disorder of the immune system, right? Which causes an infection, which causes inflammation, which causes mitochondrial
Oh,
dysfunction.
okay.
So there's some
Okay.
steps in there they're not aware of yet, which is what I
Okay.
work on.
So it's the excess sugar, like you said, how that affects the immune system, causes the virus to come on, causes the what is the thrush, the candida, that to come on.
Well, actually, no, that's out of order. So
No?
it goes like this. So sugar,
Sugar
yeah, sugar knocks your immune system down and feeds candida.
feeds candida. Okay.
Candida allows Porphyromonas gingivalis to thrive. Porphyromonas gingivalis turns off your antiviral immunity. Then the viruses that you're carrying anyway get reactivated and start replicating. There's no pain sensors in the brain, so that only manifests as a mood change or tiredness. And then you get the mitochondrial dysfunction and disorders of autophagy, which those viruses cause. So you see it's a cascade and you don't have to have any of it. And you don't even
Yeah.
have to worry about all of this if you just eat meat, is what you do. And it works, right? It
And
works.
so a lot of people in our community, in the carnivore community, are older. They're in their 40s, 50s, 60s, and beyond. And a lot of the young people, some of them have come on. I've met a few, but they haven't adopted this way of eating. They're more in the calories in, calories out, exercise a lot to keep the weight down, look healthy, live their life, do what they want to do, eat what they want to eat. What do you suggest to them?
Well, what I noticed myself is I didn't really start to notice health issues like say joint pain, etc., and starting to feel more until I was like over 45, 46. So,
Okay.
and I think that's pretty common. And so people don't shift their habits very much until they have a reason to. That's typical. But now let's think of your neurological network throughout your body. Think of it as a highway system, right? So if you were carnivore from a young age, it would be like having road crews constantly keeping your highway system perfect, your neural networks perfect, right? Those viral reactivations would never happen. Every time viral reactivations happen, they make your myelin sheath all raggedy. And then if you're still eating sugar commonly, you won't repair it. And so it'll come to a point where the cladding on your neurons, on the wires, it's raggedy enough that it ceases to function properly. That's when you get neuropathy and dysfunction and this is what's amazing is that I'm convinced that all of these chronic diseases, they're all caused by the same mechanism, which is why if you watch Dave's interviews, his 1100 that I've seen, find me one disease other than advanced cancer that doesn't get fixed by carnivore. I haven't seen any. It
No.
cures everything, which is
That
such
and that's why people kind of don't believe you
right.
because you're putting this thing out as like a cure-all and they're like, "Ha, it's like snake oil, right? Doesn't work, doesn't work." But I think both of us here are here to tell you, yes, it does
We
work.
know it works because
Eh,
that number of people cannot be wrong, and these are smart people, and it's really it's so thrilling because it means that none of us really need to have any of these chronic diseases. There are, oh, let me come back to the issue of genetic risk. Like for Alzheimer's, there's a gene called apolipoprotein E, where
Yes.
if you have a certain allele, which is called epsilon 4, so they'll call it ApoE4 for short, you have a much higher risk, like 15 times higher risk of getting Alzheimer's. Why is that? They didn't know it for the longest time. Like, why? Well, it's because that version of the protein those people inherited, it has two surface arginine residues. Arginines are these positively charged residues that those gingipanes attack directly, and they cause the protein to misfold and cease to function. And ApoE is essential for your immune response. So those people have an even more impaired immune response, and to some degree also the allele epsilon 3 has one arginine and gets a little bit impaired. But the beautiful thing is there's so many people all around the world studying the pathology of every single one of these diseases. Like people spend their whole lives trying to understand multiple sclerosis, working with patients and doing clinical trials and all these drugs that got developed. There are so many people putting so much energy into understanding the pathology. But really, once people get their immune systems on point, that will solve it, as best as it can be solved. So you don't have to study the pathology anymore. I think what I feel like we're missing right now is kind of a way to tell a patient, okay, let's measure these things in your blood and tell you, is your immune system strong enough? Maybe that needs to be a functional test. Maybe they need to take your white blood cells out and put them through their paces. And they'll
So that
say,
is a possibility. You can do that.
oh, you certainly can do that. I've been watching a bunch of Dave's interviews, on his No Carb Life channel the last few days. And I've seen like 3 different ones where they had gotten fired by their doctor, kicked out of the practice for being carnivore.
I was so afraid of that, Annalise. The first time, first few months where I was a carnivore, I'm like, I'm not telling the doctor,
You were smart.
And then the second time, I was a little bit, I'd watched a lot more videos. I've learned about myself and learned how I was feeling and learned why I was feeling this way. So I did broach her with that, but I didn't challenge her. And I think that's what people have to be careful for because the
Yeah, don't,
doctors have
I
all
would
this
say,
education. They have all
yeah,
don't say, I know better than you because I watch YouTube, right?
yeah, don't challenge them.
No,
It
no,
won't
just
go
say,
well.
I know how I feel and I'd like to tell you about that and what I've been doing.
And
That's what I did.
let's also I want to come to the topic of vaccine in this
Oh,
country,
good. Okay.
vaccines in the country, because that's something I also teach about in my class. And I
Okay.
would say I'm not like anti-vaccine across the board or anything. We study the effects of vaccines on that can happen that are off target. So when you get a vaccine, the way they're designed right now, the kind of present day vaccines, the only way they decide if the vaccine worked is they look for an antibody that would appear in response to the vaccine. And if the antibody's there, they say that was successful. Now you have, some
Yes. You
immunity,
would
right?
go and get a blood test and they would recognize the antibody. I'm just thinking of
COVID.
like Hep B, or something.
Hep B, right? Yeah,
Did you get
exactly.
that? And I'm like, I don't know if I ever got that. So they took a blood test on me and they said, no, you didn't have it. So
Yeah, exactly. So that's the way we think of vaccines now. And normally what they'll do is they'll most vaccines in the United States, not the MMR, but other vaccines, they're non-live vaccines. So they'll inject like a protein they want your immune system to recognize, along with an adjuvant that activates your immune response. They'll do those together and then you'll make an antibody. But the problem is those non-live vaccines have another effect. They have what are called non-specific effects or off-target effects, where it's been shown that all non-live vaccines weaken your innate immune system, your defensive immune system across the board. So your natural immune system would be protecting you, say, at this level. Every time you take a non-live vaccine, it comes down a little.
you're
And
kidding me.
so you have an antibody against that one thing, but you're more susceptible to
Susceptible to other
everything else.
things,
Yes,
to everything
everything.
else.
And in fact, I know I saw this year's flu vaccine, this 2025 flu vaccine gave you a 27% higher chance of getting the flu. So sometimes you're even more susceptible to what it's supposed to be protecting you against, which is why I completely stopped. I am like everybody else. I kind of was always too busy to bother with taking a flu shot. Then maybe 15 years ago, I took one, which I never had one before, and immediately got the flu. And I was
So
like,
that's why
yeah,
people say that. They say,
forget it.
I got sick after I got the flu shot, and I'm thinking,
Exactly.
I don't think so. But they're right.
They're right. And because there's a million respiratory viruses, not only flu, they're all around us all the time. And so right after you get these shots, your immune system gets a little deranged by the fight, and then you're kind of opening it up. And so I personally, at this point in this country, almost every vaccine that they would try to give you is a non-live vaccine. And then the MMR is a live vaccine, but has its own problems. So I don't take any vaccines anymore. And this is all based on peer-reviewed scientific studies in large numbers of people. A lot of this was actually learned through research that was done in Africa, in Guinea-Bissau. So these are friends of mine. They first went to Guinea-Bissau in 1979, and nobody in that whole country had ever had a vaccine. They introduced vaccines, but kept really good record of, people's health as they rolled the vaccine out to the different population groups. And that's how they discovered over a 30-year study that the non-live vaccines weakened immunity. Now, certain live vaccines strengthen immunity. So one example is oral poliovirus, the one we got as kids, which was live. Another one is BCG, which is the vaccination against Mycobacterium tuberculosis. It's to protect against TB. Those are not available in this country. So you can't get the live vaccines in this country anymore. They were phased out
I
because,
remember that because I have
they
three sons, and that
exactly.
I think the older two got one of them got the live, and then they did away with the live.
Right. And then I have three kids too. Our kids are probably the same age. And, the third kid got inactivated poliovirus, not
Yes.
oral poliovirus, right?
Yes.
So turns out that oral poliovirus and BCG, those live vaccines strengthen your whole immune system. So they're like beneficial to your whole immune system. Non-live, which is like molecular vaccines, and the COVID vaccine is one of those, weaken your whole immune. So
That just blows my mind
yeah. And this
because
is
you
what,
think you're doing something healthy for yourself
yeah.
and for your children,
Oh,
right?
I mean, I didn't learn this until, actually, I did not learn this until my youngest child in 2015 had a very severe reaction to having DTaP and IPV at the same time. And
Yes.
he had a severe adverse reaction. And then I was like,
Hypervaccinosis when you get too many at the same time, right?
yeah, and
That's
he was supposed to have gotten MMR that same day, but I just had heard something vague about MMR, and I'm like, let's do that one in a couple months. All the vaccines available in this country dysregulate the immune system. And so here's my hypothesis. We see dementia on the rise, autoimmune diseases of every kind on the rise. And let me say, Bill Robinson at Stanford, he not only is researching EBV and MS, but also EBV and lupus. He very recently showed that EBV probably also causes lupus erythematosus, joint pain, chronic fatigue, and rheumatoid arthritis.
Are you aware of any studies that talk about the Hep V vaccine with multiple sclerosis?
Okay, the Hep B vaccine is the one that for many years we have given on the first day of life to American babies.
Yes.
Um,
And I
and
never had it.
oh,
I
good.
never
Well,
had it.
I
But when I went back to college, they said, you, in order to register for next semester's classes, you need to get the Hep B vaccine. I'm thinking, I'm not going to have sex with anyone here.
No.
Why?
You know,
But,
I mean, this is the thing,
but
like, is it if they give you the option to just say, yeah, I had it and give them a form, then do that.
that's what I did. But
Yeah,
then I was working in a hospital. So I said, maybe I'll just get it. I'm working in a hospital. I should probably have it. I was diagnosed like 3 years after I got that vaccine.
right. That could have
But
made a
I
big
started
difference.
getting symptoms like a year after I had
That
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 vaccine.
vaccine could have dysregulated your immunity and allowed the EBV to flare and cause the MS. It's very possible.
Oh,
Because, like I said, they weaken your immune system and
right.
there's downstream effects of that. So this is a very radical, what would be considered a very radical view right now. But I want to point out, I have gotten a $3.5 million grant from the NIH because I'm studying the live vaccine, BCG. It really does prevent Alzheimer's and Parkinson's. The BCG vaccine, the live vaccine that
What does
strengthens your immune.
BCG stand for? I don't think I've heard of that one.
Bacille Calmette Guerin. It's Calmette and Guerin were two French guys that developed it at the Institut Pasteur in France in like 1901 through
And it's used for
1911.
Alzheimer's?
No, it's actually in this country, it's only approved in a bizarre therapy for the treatment of bladder cancer, but it was originally developed to protect against tuberculosis. So, what they do for bladder cancer is they shoot a very concentrated solution of the vaccine up the urethra,
Nice.
and it causes a lot of inflammation of the bladder lining. So it's very uncomfortable to
Mm.
experience. But the people that, so they have like an induction, the really high dose initial, and then you're supposed to go get it like three more times over the next year. And that
Wow.
prevents recurrence of bladder cancer. But
Really?
they found out by studying those patients that took it in Israel and the United States that it prevents Alzheimer's. It's like 58 to 74% reduction in risk of Alzheimer's and
That's
a 20
huge.
huge and a 28% risk reduction for Parkinson's. Let me tell you why, because BCG upregulates your whole innate immune system, and it does that by it infects it's an attenuated version of the original bacterium, which was Mycobacterium bovis. It's the related bacteria that they took off the udders of cows, and then they passaged it through 14 different animals. This is like 1901. This is olden days, right?
Wow.
So when you wanted to take a pathogen, whether this was a bacterium, a mycobacterium, and you want to make it weaker so it won't cause like, illness, you just like you put it in, say, a chicken, and then you let the chicken, kind of the chicken's immune system work on it, and then you take it out of the chicken, you put it in a rabbit, and you let the rabbit's immune system work on it, and then you put it in a chinchilla, and you put it in a lamb, and that's what they did. They infected 14 different animals in series, and they came up with an attenuated version of the pathogen, a weaker version. That's what they give in the vaccine. There's actually different versions. There's a Danish strain, a Japanese strain, an American strain, and the best one is the Japanese. And so my friend Denise Faustman, she's amazing. She's at Boston. She's at Mass General Hospital in Boston.
Really?
She is a firecracker, and she's been
So
working on
she's
this.
in the research for this.
Yeah, let me I'll pull up a nice picture of her. So Denise, oh, I guess I don't know if I have it in this one, but Denise basically has been working on treating type 1 diabetes with the BCG vaccine, and she can cure type 1 diabetes
Are
that
you
people
kidding me?
people have had for 30 years. She can cure it with multiple injections of BCG. They give BCG quarterly for 2 years.
So this is done in clinical practice,
It's being done. Yeah, there's a
or
clinical
is it just
trial.
research?
It's right now in a clinical trial that's being
Clinical
run out
trial.
of Mass
Yep.
General Hospital.
Yep.
But I just saw last week her newest results, which aren't published yet. And it's very clear it's going to prevent Alzheimer's as well. And it costs 14 cents a shot, and it lasts at least 10 years, 10 to 12 years. So in Africa and many other countries, they give BCG on birth, like literally the day of birth. And we're very conditioned right now to be suspicious of vaccines for very good reason. Okay. But this particular vaccine, BCG, it will absolutely save lives given on birth in low resource settings. But it will also basically, that really benign attenuated pathogen that they developed back in the early 1900s, it will like stably infect your gut epithelium, particularly actually, and it's only a little bit of an irritant infection. It just doesn't cause any symptoms or anything, but it brings your whole immune system up quite a
It
bit.
challenges it. It challenges
And
your.
oh yeah, I need to show you one other cool
But
thing.
I have one question about research studies.
Yeah, go
So
ahead.
your friend, you were talking about the woman at Mass General,
Denise.
Denise. So she's doing this stuff and she's getting all this wonderful results for type 1 diabetes. How long will that translate into clinical practice? How long does it take
How long
for
will it
that
take?
to
Well, I'm
translate?
trying to make it really fast because that vaccine is already given to 10 million babies a year. It's been around since like 1921. It was officially approved. Oh, do you know why it didn't get approved in the United States? Okay, I'll tell you. Because they ran a clinical trial. I think this clinical trial concluded in 1911, and it was on Native American reservations in the United States because tuberculosis was a problem, and it was very effective. And so then they went to FDA and tried to get it approved, but Pfizer blocked it because Pfizer was trying to commercialize a treatment for TB at that time. So they blocked it. So it never got approved. So we don't get it. And let me just close the loop here. So
Okay.
this is my wonderful colleague and collaborator, Bali Pulendran at Stanford. You can see he's the director of the Institute for Immunity, Transplantation, and Infection. He's from Sri Lanka originally. Wonderful guy. All right, so he just published this at the end of 2023. He's been studying BCG vaccination. He's interested in these non-specific effects. And you look at the title. It stimulates integrated organ immunity by feedback of the adaptive immune response to imprint prolonged innate what? Antiviral
Antiviral
resistance.
resistant.
So that's why it prevents Alzheimer's and Parkinson's. So he
It's the
did,
virus.
yeah, so he just took wild type mice and then he characterized the immune signaling. And what he showed is, oh, and then I might as well show you this result too.
Okay.
This is the prevention of Alzheimer's by BCG. So if you didn't take BCG when you got treated for bladder cancer, you would follow the red line. So this is the proportion of Alzheimer's free patients. So you see that as you get older, you would get
Oh,
Alzheimer's. But look, if you took BCG, look how strongly protective it is. And that's a different way of plotting it, but that's been validated at Harvard. So this is real. This is real. BCG is protective because it enhances your antiviral immunity, which kind of proves that Alzheimer's and Parkinson's are viral,
virus.
essentially viral. So now you and you're really the first person I've kind of told all of this to. Right now, what we can do is a carnivore diet and exercise and, limit your alcohol, eliminate the sugar as much as you can. Eliminate the stress, anything in your life causing a lot of stress, goodbye. Yeah, and that's why the ketogenic diet and carnivore cure every mental illness too, because those are not even Tourette's syndrome. Did you see Dr. Baker? Like Tourette's goes away with
No,
carnivore of
no
all
way.
things. Because, Tourette's is so bizarre, right?
Right.
I mean,
Right.
that is also due to viral infection, then I'm going to say, because it also goes away. And think
So
about
you
it.
have a less of a chance of getting a virus if you don't eat the sugar.
Yes,
So you just stop it, make your immune system go up, and it'll block you from getting the viruses that cause downstream all these other, autoimmune diseases,
even cancer.
cancer.
Even cancer. So cancer is caused by chronic viral reactivations too. So we should look, okay, so I would love it if we introduce the BCG vaccine, because it's protective even at older ages, and you probably need to get multiple shots of it. And I even went to Denmark and brought my family there in 2022 to get it after I learned all this stuff. But you don't have to have it because really all you need to do is do carnivore. But I forgot one thing that's really important. You also have to
What do you have to do?
you should take vitamin D3 and magnesium and curcumin at least. So
Okay.
those all enhance your immune system. Vitamin D3, I would take at least 5,000 international units a day. Make sure you take it with K2 so
Right.
that because that prevents you from forming any plaque. Because vitamin D affects your macrophages when they get dosed with vitamin D, they also rebuild your bones. You know how vitamin D is important, right? If
Right.
you don't have K2 around, they can accidentally calcify your plaques if you have any.
Oh, okay.
K2 prevents that.
That's why the K2 is important.
Yeah, D3 will make sure they put everything down just in the right place. And then the magnesium is necessary for all the enzymes that process vitamin D and many other enzymes. Most people are low in magnesium, like 75%
So
of
if you
people.
don't have the magnesium along with the vitamin D, your body can't
It
process the
won't.
vitamin D as well.
Precisely. And I
Okay.
want to recommend that people take two different forms of magnesium. I take both. Magnesium threonate reaches your
Hmm.
brain.
Hmm.
Threonate and magnesium glycinate is great for your muscle. And you need
Okay.
and so that, and then the curcumin actually upregulates the innate immune system. So, carnivore diet, or as close as you can get. Look, the sky's not going to fall if you eat some broccoli, okay? But it's okay. Like you can do it sometimes. You don't have to freak out.
Can I tell you, I said to myself, maybe I've healed enough. It's been like a year and a half to almost 2 years, which I know it sounds not like a long time for you, but I was like, maybe I can start eating like keto, just a little side salad every now and again. So I started that in November, and I'm telling you, it wasn't chocolate cake. It
Yeah.
wasn't bread. It wasn't pasta. It wasn't any of that stuff. It was just some broccoli. That's what reminded me of it. Or a side salad, especially if I went out, so my plate would be kind of full and it would
Yeah.
look normal,
Right.
right? 2 weeks, a little less than 2 weeks later, I woke up with the extreme fatigue, like someone had their
Yep.
hands on my shoulders pushing me down. And I said, "You've got to be kidding me."
So you can't do that. And that's
I
what's
can't
going to
do
be
that.
really individual. Carnivore also lets you be what you're intended to be, your beautiful self that God made. Like it brings you to your ideal. And like, isn't your family so happy to see you
Oh
do
yeah.
so well?
I get comments by my kids all the time, although they do not follow the carnivore diet. I wish they would.
They will
But
when they get older.
I did a speech at my oldest son's wedding, and he came up to me after. He said, "Mom, a year ago, you wouldn't, even 6 months ago, you wouldn't been able to remember all that." And it really struck me that he said that. And then I was talking with my oldest son, and he said, "Mom, when I tell you things, you don't get as upset anymore as you used to be."
Right.
And I was like, "Oh, thank you for recognizing that." But I used to point everything out, but now I'm like, "Oh, just thank you." But
Yeah.
there's little things that, like, these are gifts that, as a carnivore, you're given these gifts every day and you don't even recognize them, and they're just given to you. And it's mind, it's body, but it's also spirit. And I wanted to ask
Absolutely.
you, because I heard you say something in an interview, and I wanted to ask you how your spiritual life has
Yeah.
changed or transformed since starting the carnivore diet.
That's a wonderful question. Yeah. And I would say, like, because carnivore calms your nerves, gradually you get more and more calm and peaceful feeling and loving feeling. You become very positive. You realize this is our natural state as human beings, right? We're not supposed to be inflamed. We're supposed to be eating the proper human diet, which is, carnivore, I think. And, maybe a few berries here and there is not going to change things. But you realize you become kind of this anomaly around all the people that are eating the standard American diet because you have that Zen. And it makes it possible then to connect, to have the peace to connect with God.
Yeah.
And I'm a Christian. I'm a follower of Jesus, and I had really gotten away from considering spiritual things just because of being busy when I had children and work was very busy. But now I'm 57, I have more time. And it's extremely important to me. And I feel like carnivore quiets your spirit and it makes you able to be more connected to God.
So what, you're a Christian. What did Jesus do when he was coming across a very difficult situation?
He did a 40-day fast.
Yeah, he
And
did.
then and then and
To
then I was listening.
connect, right?
Right. And I listened to
To connect.
I was listening to I think it was the book of Luke yesterday. And then I was, there's this part in the Bible about when Satan is tempting Jesus, right?
Yes.
And
He's up on the mountain. He had he
yeah,
had done he had done the 40-day fast up until that point.
and he keeps kind of provoking Jesus and saying, "Here, you can have
The
this," or "Why
three
does
the
it?"
three the three temptations. You could
Yeah.
have this whole world,
And
right?
Jesus is like totally zen about it. He's like, "Eh." And he just each thing he's like, "Yeah." You know, right? And
No
that should be a
thanks.
lesson to us, right?
No
Like
thanks.
he's totally, what did Jesus do? He just stays calm and he says, "No, that's not true." And just, just doesn't, and he's not aggressive. He doesn't fight or yell at Satan.
No.
He just says, "No, no." And that's
No.
all we need to do. Not today, Satan.
Yeah. Yeah. So you incorporate fasting into your
Yeah, I
plan?
did a 40-day water fast in March, April 2023, and it was challenging. And especially like in the last 3 days, my electrolytes got out of balance and I really had to stop on day 40.
Right, right.
But next time I would handle my electrolytes better with, like these element drinks or something like that. But it was so good for me, and I healed my Hashimoto's finally. I had pretty severe Hashimoto.
Amazing.
Did you know that
Amazing.
I just learned like 4 days ago the birth control pill, if you take it chronically for many years, causes Hashimoto.
You got to be kidding.
Now they tell us.
Now that I'm done with all that.
Exactly. Exactly. Hashimoto's is very annoying because your metabolism gets thrown off, right? Your thyroid doesn't work properly.
So I'm going to tell you what I'm doing. And I started it yesterday, the first day of Lent. I'm doing a 40-day sardine fast.
No, my goodness. How are you going to do that before you said after 3 days of sardines, your appetite was
I
gone?
know. I know. I'm on day two. I've got a whole different mindset to it, though, I'm telling you, because I'm thinking, okay, this is day two. I could do
Well,
this. I
here's
could
what
do
I'd say.
this.
If on day
Yeah.
three, like last time you did 3 days of sardines, you find your appetite is pretty low, consider transitioning to a pure water fast from a sardine fast.
Good idea.
Just consider it, and then even if you carry
Maybe
it out,
oscillate back and forth. Then when I get too hungry,
yeah, then have
have a
some
can of
sardines.
sardines. I was thinking of that too because there's a point where those little fishies really kill your appetite.
Yeah, they're disgusting. So no, I have to go try some. But you know what? That's a great idea. Like if you were trying to do a water fast and you felt really weak, you just eat some sardines. You're still in deep ketosis. That's a
Exactly.
great idea. But I
Exactly.
think that the deepest healing, and maybe you still need this, because I think if you did like a longer water fast or sardine
Right.
fast, it will finally
That's what I'm thinking.
completely
That's why
clear
I'm
these
asking you
lesions.
about this because
Yeah.
sometimes, like I say, nearly 100% of the symptoms that I've had have healed by following a carnivore diet, a strict carnivore diet, fatty meat, butter, bacon, eggs, very little fish. However, there are times where I get tired. I don't know if that's just a normal human being tired because,
No, it's
I am a
probably
human being.
EKG.
I'm a 60-year-old woman. I turned 60 last year.
Yeah.
And, but part of me doesn't want to accept that. I don't want to accept that age is doing that to me. Like, I think there is some room for healing. And I'm wondering if by doing this,
I
I,
promise you, yeah,
yeah,
it will continue healing your lesions. That you've only been doing this like 2 years, right?
it'll be 2 years, March 5th.
And it's amazing how much you've changed in that time.
Oh,
So I would say, like, for science, I would, try to like do the sardines fast, and try to do some water fasts. And I think transitioning from a sardine fast to a water fast, that's probably really brilliant because,
that was in my mind because I'm
yeah,
I'm thinking to myself, there's gonna come a time where
well,
I'm gonna
because,
open a can of sardines and go, oh
oh
God.
God, no, I cannot. And then,
But I
and then
am
just
doing
have water.
salmon and mackerel as well, and I can stomach those a little easier. And I know they're high in omega-3, and they've got a similar profile,
Okay,
very
that's
similar
very
profile.
good. That's very good. And I'm like you with fish. Like I will never overeat
I
fish.
love a lobster, love haddock.
Oh, sure, lobster with butter is fantastic.
Yeah.
So try that, because you are being followed in Dr. Anthony Chaffee's study. And if you reverse your lesions, you are going to prove to science what the carnivore can. So I'm begging you do this, because it will work. Yeah, now think of this now. Isn't this like a jubilant occasion when we realize that, okay, yeah, we're all stuck with these viruses. We all have them, but we don't have to let them affect our lives, and we don't have to feel unhealthy, and we have the solution. And so we'll get all this published, and
I love that.
and
I
it's
just
done.
love the work that you're doing. And thank you so much. I'm so grateful for you because we need you. We need you because you have that knowledge, you have the wherewithal, you know the science.
Yeah.
You
And that
know how it all works and you know the cascading, how all these viruses and all the stuff gets put together.
I'm so happy for you, and thank you for
Oh,
sharing your story with everybody. And every one of us is just trying to make the best of the life that we have, and this is how to do it.
yeah, well, thank you. Thank you for coming on and sharing all your knowledge with us. Thank you
Yeah.
so much. It's
We'll
been a
talk again,
pleasure.
and I'll send you an email, and I can send you a link to a couple of the papers I mentioned, okay?
I would love that. Thank you so much. I'll put them in the show notes.
Okay, take care.
Okay. Bye bye now.
Bye.